Welcome to Disability Advocates Aging in Place and Assistive Technology Series. Disability Advocates provides in-home evaluations and is able to assist you in these areas.
In this series, we're going to talk about bathroom-related equipment. As an occupational therapist, we come and do assessments for those seniors in the area. And with those assessments, we often spend a lot of time in the bathroom because that's where a lot of people have issues, whether it's getting on and off the toilet, in and out of the tub, or the shower. So today, that's what this is going to focus on. The first thing we're going to start with is the toilet. There are many options out there for risers. A couple that we have here today is this one. This is more of an insert style. This one is one of my personal favorites because you still get to sit onto the toilet seat. This raises you up about 3 to 4 inches, and then you have the arms that are there and padded as well. So this one actually attaches to the toilet bowl, so it's nice and secure. And then again, you still have your toilet seat and your toilet lid that you can use. This other one here just clips on with using like a clamping system. Again, it raises you up to about 4 inches. This one's nice because if you have other family members that you're living with, you can take it on and off so that they don't have to deal with it. Or if you travel to maybe your daughter or your son's house, it's something that you could take with you, so that way you can use it use the toilet at their bathroom. Again, super easy to install and fairly secure. Lots of options out there. Something to look for though is the shape of your toilet. There's elongated or round, and that will make a big difference on what equipment you buy. So we always recommend having a professional come out because there are so many options. And to make something so you're not wasting your time or your money, it's best to have someone come out and we can talk about what's going to be the best for you. Some other options, if the height is okay in your toilet, and maybe you just need arms. There's toilet rails out there. There is something like this. Again, it attaches to the toilet bowl and it gives you arms to hang on to, but it doesn't affect the height of the toilet. So maybe if you have a comfort height toilet and that is fine, you just need something to push up to get off. There's this option. And then there's also this option. This is called a Versa frame. And again, attaches to the back of the toilet. This is a decent option. The only thing I don't like about it, if you have balance concerns, you do have the legs of the frame to worry about, whereas some of these other options, there are no legs that go to the ground. So this is a great option, but again, balance concerns, worried about tripping over, you do have the legs here, and some people do complain about it being shaky, so it's something else to consider. And then here is a commode, which most people have seen before. What's nice about these is they can be used in, if you can't get to the bathroom and you need it in your bedroom, but also you can use these over the toilet as well. And so you can raise it up as high as you need it. There are splash guards, so that way you're not having to worry about making a mess. So this is very versatile and you can use it in different options. And there are some that if you needed to use a slide board, for instance, there's ones that have more of a platform with the cutout that you could slide board back and forth, ones that the arms drop down. So a lot of different options depending on your needs. The next thing we're going to talk about is your tub or your shower. There are many different types of setups. Not everything is very standard when it comes to the heights of the tub walls and the tub widths. So it is important to look into that before you start purchasing equipment. One of the options here that I have is a tub mount bar. What this does is it clamps onto the side of your tub, and it just gives you something to hang on to when you're stepping over the tub wall. Again, it's important to look at the edge of your tub, the lip of it, because this goes to about 6 inches, and there are tubs that are wider than that. So this is just an option if you aren't able to install grab bars, which is what we would typically recommend and what's ideal, but it's not always possible. So this is an option to help people step over the tub wall, but also if you like soaking in the tub, this also gives you a bar to hang on to if you need a little extra help getting up from the soaking in the tub. And then here I just have a shower chair. There are lots of different styles and types. There's ones with backs, without backs. There is ones with arms and without. Just kind of depends on what you're looking for and what you need. But again, things to consider is the width of your tub and if it will accommodate the shower chair that you're looking at. There are transfer benches out there. And how these are used is you would put this into your tub where 2 legs would be in the tub and 2 would be outside. And what that does is it just eliminates the need to step over the tub. You're actually just going to be sitting on the edge and then scooting in. These are nice, again, if maybe you had a surgery where you just need something temporary and you can't put weight on one leg or you can't get in as safely as you would like. This is a great option because it just eliminates that whole risky maneuver of stepping over the tub wall. There are little grippy tapes out there. You can get them in different shapes, different colors, and what it is it's just tape that is textured, and these can be put down onto the bottom of the tub. I've seen also where people put them onto like grab bars or maybe in front of their toilet just to add a little bit more texture. And this next little handy device is a suction cup handheld shower head holder. We love to hand out those handheld shower heads, especially if you are using a bench or a chair. It just makes it way easier to shower. Or even if you have a caregiver that's there helping you, this is the handheld shower head is a really nice thing to have. And what this does is it suctions onto the side of the wall, so that way you have a place to put it. Otherwise, you kind of have to let it drop down to the ground, and then you're reaching forward to try to grab it. So this just puts it where you can have it nice and close to you, easy access. Other things to consider is having a bath mat that has the suction cup grippies on the bottom to help reduce the slipperiness of the inside the tub. And then also a rubber back mat that has the outside of the tub, so that way when you step out, you are not stepping into a pool of water.
Hello, my name is Therese Marshalletta. I'm an occupational therapist with Disability Advocates of Kent County. My role at Disability Advocates of Kent County is to perform home assessments. The goal for many of our consumers is to age in place and stay in their current living situation. In 2018, 1 in 4 older adults reported experiencing a fall. 8 million of those falls resulted in medical attention or limited activity for at least 1 day. More than 32,000 older adults died from falls, which is the equivalent of 88 older adults dying each day. Over 10,000 people in the United States turn 65 every day. Death rates from falls increased 30%. Some risk factors for falls are, but not limited to, being older than 75 years of age, homebound status, live alone, history of previous falls, and difficulty with getting up from a chair. The timed up and go test, the purpose of it is to assess somebody's mobility. The only equipment you need is a stopwatch, and the directions are as followed. Patients wear their regular footwear and can use a walking aid if needed. We begin by having the patient sit back in a standard armchair and identify 10 feet away on the floor. Can you see this chair in front of you, Judy? Okay. On the word go, I will begin timing. The instructions are, when I say go, I want you to stand up from the chair. Walk to the line on the floor at your normal pace, turn, walk back to the chair at your normal pace, and sit down again. Got it, Judy?
Yeah.
All right. Okay. And go. Okay. So that test took Judy 9 seconds, and she's in the age bracket of 60 to 69 years of age. And for that age bracket, if it takes a person greater than or equal to 14 seconds to complete that task, they are associated with a high fall risk. And it goes up from there depending on their age bracket. There are 4 key factors for preventing falls. The first one is vision. Aging is associated with some forms of vision changes or loss that increase risk of falling and injury. It's a good idea to have your vision checked yearly and your lenses updated as needed. Simple home modifications for vision are using dimmer systems to help control your environment, and the use of task lighting can help with reading, food preparation, and other close work.
A couple of adaptive pieces of equipment you can use for low vision. We had discussed lighting is so important, and there's a handheld lighted magnifier that you can use if you have to read a label or if you're reading your book at night. They also come large enough that they are the size of a book, and maybe set on a stand where you could actually read with the lighted magnifier.
The use of night lights can prevent falls in the night, especially when one gets up to use the restroom. And lights may be placed underneath kitchen cabinets, where they can also help illuminate work areas in the kitchen. Medication is a second key factor to look at when preventing falls. Medication can increase fatigue, dizziness, and poor decision making. Know the side effects of your medications. In particular, pills used for sleeping and pain management can cause a person to be less sharp and not pay attention to curbs or uneven sidewalks. Ask your doctor or pharmacist to review your medications to see if any might increase your risk of falling. It's also important to ensure you're taking the medications at the right time. You can use a pill box or a talking alarm clock that alerts you when it's time for another dose. For an increased cost, there are also automatic pill dispensers with presets. The third factor is exercise. It's never too late to start exercising. Lack of activity can lead to more doctor visits, more medications, and more hospitalizations. Exercise also helps manage stress, improve mood, and decrease depression, which decreases need for medication, which decreases risk of falls. It's all interconnected. There are many local community resources for exercise. The YMCA, Senior Neighbors, Area Agency on Aging of West Michigan, to name a few. Tai Chi or yoga are great exercises to prevent falls because you're working on multiple planes and not just a straight path like you would with walking. Tai Chi practices stepping to the sides and back and forth, as well as reaching out to the sides, reaching up, and bending over. By practicing these moves, you are increasing your postural stability and your base of support widens. You train your body to right itself if you feel slightly off kilter. The fourth key factor is environment. Making small adjustments to your home environment can increase safety drastically. Falls can occur anywhere, but many people have told me they fell leaving or entering their home. Be mindful of the condition of your steps on the outside of your home. Uneven cement walkways or steps, algae on wood patios or steps, snow and ice, and piles of leaves on walking pathways can all be hazardous and lead to falls. To decrease falls, maintain the outside of your home, have adequate lighting, use lever handles because they are easier to use universally, and check to see if your door width is at least 32 inches wide to accommodate a walker or wheelchair, if need be. It is also a good idea to install bilateral handrails on either side of steps leading up to the home. If you have any questions or concerns regarding these areas of your home, please give Disability Advocates of Kent County a call, and we would be more than happy to do a home assessment for you. To prevent falls in the kitchen, try and rearrange furniture to avoid using a step stool. But if one is necessary, use this kind with a handle.
We prefer the one that has a handle on it so that you have something to be stable when you're taking that step up.
For the bedroom and other areas of the home, ensure there are clear and wide passages to walk through. If you have electrical, phone cords, or oxygen tubing, make sure they are tucked away and not crossing doorways. Avoid using throw rugs, but if you really love them and can't do without, secure rugs with double-sided tape. Sometimes using color contrast on steps is helpful to see each step clearly. Decluttering your home is very helpful to decrease falling injury risk, and being aware of your pets and their location is also helpful to avoid tripping on them when they're underfoot.
There is an art to falling safely. Step 1, stay bent. Step 2, protect your head. Step 3, land on the fleshy parts of your body. And step 4, keep falling. How to fall without injury. Fall sideways if possible. Aim towards open areas, towards grass or dirt. Aim away from people or objects that can cause fracture or puncture wounds. Fall like a sack of beans. Relax everything. Fall on soft, fleshy places, your buttocks or your thighs. And you can get up by yourself, if you can. The steps, first of all, just lay down and remain calm. Take a little deep breath. When ready, bend your knees and roll on your side. Get on your hands and knees. Slide or crawl to a sturdy surface. Put your good foot out in front of you first and good hand on a surface. Pull yourself up and sit down. Call for help if you're hurt. And if you cannot get up by yourself, hopefully you'll be able to use your personal emergency response system or your cell phone to call 911.